Hi, I'm Tracy Moyston, and I'm a junior biomedical engineering student at the University of Rochester. Right. So in this study, we examined the effect of continuous pilocarpine stimulation on calcium flux response in developed salivary gland mimetic tissue chips to help characterize screening assays that may be useful in the identification of radioprotective drugs in the salivary gland. Xerostomia, or chronic dry mouth, occurs in more than half of the patients that undergo radiation therapy for head and neck cancer treatment. Xerostomia is caused by off-target radiation damage to salivary glands, which leads to loss of function in the secretory acinar cells. Xerostomia can lead to oral discomfort, tooth decay, and increased risk of oral infections. Current treatment does not restore function, and there is no appreciable tissue regeneration over time. Therefore, it is important to identify drugs that are able to prevent this radiation damage. Drug discovery has been hindered by lack of in vitro models. To effectively screen for such drugs, we need salivary cell cultures that can maintain secretory function and phenotype. To bridge this gap, we have developed polyethylene glycol hydrogels to encapsulate and culture salivary gland cells. Within these gels, salivary gland cells organize into tissue mimetic structures which maintain acinar cell functions. We combine this approach with microbubble array technology, wherein cells and gel are seated in high-density arrays of 15 nanoliter spherical cavities molded in PDMS. The microbubble shape allows for concentration of cell-secreted factors and provides a high-throughput drug screening platform. We aim to utilize this model in the screening of radioprotective drugs and first look at this secretory response with pharmaceutical compounds known to impact secretion. In this study, we examined the effects of chronic treatment with the secretory stimulant pilocarpine. Acinar cells respond to secretory stimuli by calcium flux or intracellular release of calcium, which leads to the secretion of saliva. We measure this response by loading the cells with Calbrite 520, which fluoresces in the presence of calcium. We then treat the cells with known secretory stimuli and measure fluorescence intensity in each microbubble over time. To carry out this study, murine salivary cells were suspended in polymer solution and seeded into microbubble chips prior to photopolymerization. Daily pilocarpine treatments of 0 micromolar, 10 micromolar, and 100 micromolar were carried out on these encapsulated cells for a 14-day period. At day 7 and 14, calcium flux response was measured to determine the stimulatory response to carbachol and ADP for each condition as measured by Calbrite fluorescence. RNA sequencing of freshly isolated salivary glands confirms expression of muscarinic and purinergic receptors, which are the target of our agonists, carbachol and ATP, respectively, as well as pilocarpine, a muscarinic agonist. We do observe a decrease in cell viability in the 100 micromolar condition as seen in the bottom figure in the middle column. That would be figure 3B. However, a majority of microbubbles do retain live salivary gland spheres through day 14. Treatment with 100 micromolar pilocarpine increased the maximum response to ATP and significantly reduced delay. Interestingly, treatment with pilocarpine reduced the maximum response to carbachol at day 7, but the low-dose pilocarpine treatment increased the maximum response to carbachol at day 14. This data provides some insight into the calcium flux response of pilocarpine using this model. Moreover, we observe that we are able to manipulate the calcium flux response and quantify metrics, including maximum response and delay. We are able to observe statistically significant difference in these measurements, which may prove to be effective metrics in the identification of radioprotective and sialogenic or saliva-inducing drugs. Our plan is to use this model to further characterize the responses with known sialogenic and xeranergic drugs, as well as in irradiated versus non-irradiated cultures. And eventually, this would be used as drug screen for radioprotectants. I thank you.